All right, welcome everyone. We're sorry for starting late. There are some circumstances beyond my control, so let us just start quickly. Today, we will start with last time we talked about social actions for community mobilization. So, the intention today is that we'll talk about. Let me share my slides so that we'll be on the same page. All right, I guess you can see my slide now. Okay.
Yes, sir, we can see. Good evening, sir.
Okay, good evening. Sorry for starting late. All right, now today we'll be talking about community modernization programs in Nigeria. We'll be talking about some of the past programs. We'll be talking about some of the future programs. So let's see. Let's not talk about the future because we don't even know how the future will be. So let's talk about the past and the present programs as our lecture materials have it. So let's do that quickly. Now, at the end of today's session, the expectation is that every student should be able to discuss some of these programs. One of the programs is MAMSA. As we continue, I'll explain to you what MAMSA means. You highlight the objectives. In fact, let us do it this way. At the end of today's program or session, every student should be able to explain the objectives, the achievements, and the failures of the programs we are going to be highlighting today. So if we're going to highlight 5 of them, 1, 2, 3, 4, 5, just make sure you know what the program is about, the objective the program is set to achieve, the and achievements it eventually achieved, and then the failures that were attributed to it. So let's go straight to the first. The first is MAMSA. I don't know how many of you were old enough at the time MAMSA was a play. I think I was old enough. I know I was old enough. Yes. MAMSA simply means mass mobilization for self-reliance, social justice, and economic recovery. It was around 1987, thereabout, when I think President Babangida was in power. Now, the mass mobilization for self-reliance, social justice, and economic recovery was an exercise in political orientation. They were trying to change the mindset of people at the time, right? Now, it was just to change the orientation of people at that time, mass orientation, political orientation in Nigeria. Now, under the President Babangida's regime, it was recommended, it was a recommendation of the political bureau headed by Dr. Samuel Koki, also. Joseph Koki. Now, the Bureau was tasked with the responsibility of responsibility to consult with thousands of Nigerians and then recommend to the Armed Forces Ruling Council at that time. Armed Forces Ruling Council was headed by the President General Babangida, was tasked with the task to recommend to that Armed Forces Ruling Council a respectable way and a methodological way of transition program from military to democracy, that is political orientation. Now, one of the things you will note, let me say it because some of you may not be, the younger ones may not understand what was really happening there because we've enjoyed almost something years of steady democratic regimes. So some of us have forgotten what the military regime used to be. The military regime used to be very regimented, used to be very, very regimented. There was no freedom of speech like you have it today. You can go on social media now and criticize anybody. Once you do that constructively now, according to the law, you are free to go. But criticism, you can criticize. In the newspaper, you can make a cartoon of a president or a sitting governor, and you will get away with it. A lot of people can do a whole lot of things now and get away. There was freedom to even do certain things. But with the military regime, it wasn't like that. And that time, the military regime were under pressure by the international bodies to hand over to civilian government. So that particular program was targeted at political orientation to change the way people see and deal with each other in terms of orient them to have the mindset of democracy so that they can easily transit seamlessly once government changes. Now, the ruling council also wanted a national orientation to enunciate the abstract idea in its economic policy and to promote value orientation. That's they wanted to sell themselves that they were doing well. No matter how people felt they were doing, they just wanted people to see that they were doing. So that task at that time was part of preparing people for democracy because they wanted to hand over to democracy. But they were also selling themselves, trying to wash themselves so that they look good in the eyes of the people. So MAMSA was that program that was empowered to do that at that time. So it was inaugurated on the 25th of July, 1987. 1987. Now, what was the mission of the program? Some of MAMSA's official policies were one. Let us start with the mission. The central goal of MAMSA was to cultivate support for the transitional program of the government at that time. You see the summary, it was just to garner people to support how the government would transit from military to democracy at that time. It was also an avenue to educate the citizens about the political process that was about to come and was in place, to mobilize them to participate in an upcoming election and political debates that were going on here and there, and also inculcate dependency on locally made goods and Nigerian product in the minds of the people, because then people are always looking out for foreign made goods like that. I think it's still prevalent today. Now, what is the official policy of MAMSA? One, reorient Nigerians to shun waste and vanity. Two, shed all pretenses of affluence in their lifestyle. Three, propagate the need to ensure all vices in public life. In public life, there's things like corruption, dishonesty, electoral fraud, census manipulation, ethnic and religious bigotry. I don't know whether some of you have seen similarity of what this program was trying to solve as of 1987 and the problem we're trying to solve today. Let's continue. Now, what is the objective of MAMSA? The visionary setup for achieving its aim and objective is both a learning process and activity process. So as a learning process, MAMSA has workshops, seminars, and establish resource panels through which they sought to tap the immense intellectual resources of the academia, those in the universities and higher institutions, and various professionals or professional groups. As an activity group, its objective was the 12-point mandate of the directorate, as it was encapsulated into three closely related programs like the MAMSA, that is mass mobilization for self-reliance, social justice and economic recovery, consigned with physical acts of mobilization, one, mass education, two, under which a literacy society or a literate society by 1992 was the target, was the goal, political education, on which platform a politically aware people should run. A conscious and enlightened third republic rests, and that is the platform upon which the third republic at that time rested. And it's a special program that was also crafted for mobilizing the military and the family at that time. You may ask the question, why mobilize military and family at the time? Well, let's continue. Maybe we'll find out in between. Now, the goal of MAMSA is to inform and guide Nigeria's development objectives. All right. When we say MAMSA, it simply means mass mobilization. So the goals of mass mobilization for self-reliance, social justice, and economic recovery is informed, is driven by Nigeria's development objectives. Now, what are those objectives? One, to build a united, strong, and self-reliant nation. That's Nigerian development objective. Two, to build a great and dynamic economy. Three, to build a just and egalitarian society. Four, to build a land of bright and full opportunities for all citizens. And then the last one, which is the fifth, is to build a free and democratic society. That's the Nigerian development objective. It still stands to today. Now, what are the achievements of MAMSA? One, achievement in align to they achieved. One of the achievements is that there was achievement in enlightenment of masses on the upcoming election by that time, and to improve welfare of the citizens and to investigate and control corruption in Nigeria. Yeah, that was an attempt. Anyway, that's one of the achievements. There was a lot of mass orientation. Another achievement in the Directorate's economic recovery program, such as popularizing the National Economic Restructure Fund, that's NAFund, a program in which the government has invested about 4.1 billion for small scale industries to strive in Nigeria. The third achievement was creating a conducive social and technological basis for sustainable development. And number four was transformation of poor production structures through agricultural and industrial development. Now, let's see what next. Number five achievement was facilitating the greatest possible development of agricultural or agri-fed industry so as to ensure mass production of food and industrial raw materials. I need you to note some of these achievements because they are key. They are very, very key. Now, number six, minimizing the phenomenon of external dependency and reliance on foreign aid. Number seven achievement of MAMSA was to ensure the fullest possible utilization of human and material resources. Number eight achievement was the transformation of consumption pattern to reflect self-reliance, that is, we relying on ourselves as a country uh, and our productive structure. And then number nine, elimination of mass poverty. I don't know if it was really an achievement. Well, maybe at that time it was. Then number 10, creating opportunity for useful employment on a scale that will harness the potentials of the unemployed. These are the achievements. Now, another program that was established for community modernization was the River Basin Development Authority. This particular program or authority was established to provide water for irrigation. Now, some of you may not get the point, but let me explain it. You know, irrigation is a kind of system where water is made available for farming all year round. Naturally, the rain provides water in the rainy season, and the dry season there's no water. But with irrigation, water is provided even in the dry season so that farming can continue. That way, such a community, such a country will ensure farming and food sustenance and availability all year round. So the River Basin Development Authority was a program established to provide water for irrigation and domestic water supply for places where domestic water supply was not available, and to improve navigation, hydroelectric power generation. You see, all of these things are related to water, recreational facilities, and fishery project. So that's the River Basin Development Authority's mandate. It was established for all this. Now, the Basin Authority were also expected to engender big plantation farming and encourage the establishment of industrial complexes that could bring private and public sector in joint business partnership. So you see that. Now, what is the objective of this authority? One, to undertake comprehensive development of both surface and underground water resources for multiple purpose use. Another objective of the River Basin Development Authority was to provide water from reservoirs and lakes under the control of the authority for irrigation purposes to farmers and recognized associations as well as for urban water supply use. Number three, the control of pollution in rivers. The authority was vested with the responsibility to control the pollution of rivers, lakes, lagoons, and creeks in authorities' area in accordance with the nationally laid down standards. The fourth objective was to resettle resettle persons affected by works and schemes, specifically under special resettlement scheme. The authority also have another objective to develop fishes and improve navigation on the rivers, on the lakes, on reservoirs, on lagoons and creeks in the authority's area, because the authority had area of uh, area of scope of its work where they have to cover. The sixth objective was to undertake mechanical clearing and cultivation of land for the production of crops and livestock. The seventh objective was to undertake large-scale multiplication of improved seedlings, livestock, and tree seedlings for distribution to farmers and for afforestation schemes. We also had the eighth objective was to process crops, livestock products, and fish produced by farmers in the authorities area in partnership with state agencies and any other person. So these are the objectives. The ninth one was to assist the state and local government in implementation of rural development works, which included construction of small dams, provision of power for rural electrification scheme, establishment of grazing reserves, training of staff in the authority area. Now, what are the achievements of the authority? The first achievement of the River Basin Development Authority was the past government has been able to help in agricultural development and increase food supply and aquatic activities. So this is one of the achievements, helping to achieve food supply. The second was to the reduction in high level of drought. The third was food prevention and management control. The fourth was there is a great increase in domestic water supply. So they achieved increase in domestic water supply. The fifth is that they were able to boost hydroelectrical power supply. Sixth is that the River Basin Authority were able to bridge the gap between rural and urban centers by taking development to the grassroots and discourage migration from the rural areas to the urban areas. The seventh was the creation of the authority of the River Basin and Development Authority, as it motivated Nigerian federal government to facilitate and accelerate the production of food crops and mobilize rural agricultural production throughout the country towards increased food production. So his achievement was to increase food production. Now, the eighth achievement was that it was able to solve the problem of declining agricultural productivity and for encouraging the diffusion of agricultural innovation to the rural areas in ways conducive to increase agricultural productivity. Now, we've talked about two of these programs. Let's talk about the third one. Like I said, you should note some of these achievements, note their objectives, because these are the key areas where likely research exam questions may be coming from. Now, Nigeria Agricultural Insurance Corporation. From the very beginning, the scheme covered only two crop items. Note this: maize and rice. Two livestock items, namely cattle and poultry, and some commercial businesses like farm building, machineries, and equipment. So you see, the scheme had its limits of what it was covering. Now, the cover has since been extended after the first initial covering to include more items, namely like 21 crop items, 9 items of livestock, and 12 types of commercial businesses. And at the present, efforts are being intensified to increase the number of items on the cover to include fisheries, perishable vegetables, and more horticultural products. It equally designs specific covers to suit peculiar customer needs. For example, it has designed and implemented a special type of cover. When we say cover, now I hope you understand we're talking about insurance covering. Cover for agriculture and produce marketing loans as follows. So the Nigerian Agricultural Insurance Corporation had an insurance covering for fire and special perils. It covered for properties and collateral security for marketing loans. It covered the burglary insurance and for produce in storage. So that particular one is called burglary insurance cover, which covered produce and storage. Then the one that is called fire and special peril cover covered properties used as collateral security for marketing loans. Now, there's another one, fire and special peril cover. This particular cover, insurance cover, covers for produce, for goods and other materials in storage in warehouses. Again, there are goods in transit policies and cash in transit policies. Therefore, prospective clients can always approach any Nigerian Agricultural Insurance Corporation office for the possibility of arranging special types of cover to meet their needs. The insurance corporation has operational presence in the 36 states of the Federation and the FCT, including. There are 5 zonal offices that provide these state offices. Okay. Now, these plans are in the pipeline to open more field offices in the local government areas and districts. This was established for all categories of farmers, and the scheme operates a mandatory cover which applies to the following areas. These are mandatory covering areas. One, all agricultural loans from banks taken from all items insurable by Nigerian Agricultural Insurance Corporation. They should be covered. Two, all agricultural and agro-related projects which are assisted, supported, or fully funded from the public funds. They must be covered by this insurance corporation. Now, another one that must be covered is all direct and non-lendable loans or all direct and on-lending loans taken by all tiers of government like the federal, state, and local government for disbursement to farmers and agricultural projects for implementation. They should be covered by this insurance corporation. Then, all forms of loans for agricultural marketing purpose by all banks and non-banking lending agencies should be covered. All direct on-lending and investment loans disbursed by the Nigerian Agricultural Cooperative and Rural Development Bank. Of course, you know this particular bank no longer exists. Okay, what replaces it today is Bank of Agric. Now, the peril under cover for the crop subsectors are drought. That is the things you can cover under this insurance is drought. In case drought takes your crop, look at this insurance will repay you. Flood, windstorm, fire, pests, and diseases. And then as it concerns livestock, what can you cover? The perils covered are death of your livestock and injuries due to accident, disease, fire, lightning, and other forms of natural disaster. However, it is very important to note that losses caused by negligence or willful damage are not covered. Okay? Now, what are the objectives of this particular insurance corporation? One, to implement and manage and administer the agricultural insurance scheme. Two, to subsidize premium chargeable on selected crops and livestock policies from the grants obtained from federal, state, and the Federal Capital Territory. Number three objective is to encourage institutional lenders to lend more for agricultural production, having regard to the added security for their loans provided by the corporation. Because you know, once there's an insurance policy covering a particular loan, the lenders can easily give out the loan, knowing fully well that if it goes bad, they will be paid back by the insurance company. And number four, to promote increased agricultural production generally. All right. In order to minimize or eliminate the need for ad hoc assistance previously provided by government during agricultural disaster. And then next is to carry on insurance business on normal commercial basis and without subsidies on premiums as insurers of building, maybe machineries, equipment, and other items, which form part of the total investment on farms and to reinsure this aspect of its operations through well-established channels with a reputable insurance company. Now, the next objective is to operate other types of insurance business as may be permitted. The next is to do anything or to enter into any transaction which, in the opinion of the board, is calculated to facilitate the due performance of its function. Now, let's talk about another program, the National Directorate of Employment, NDE. The NDE was established in November 1986. It began to operate fully in January 1987. The birth of this directorate was predicated on the effects of the economic recession of the 1980s, which led to a drastic reduction in the capacity utilization and consequent outright closure of industries in Nigeria. So the NDE was established. One of the objectives of the NDE was to design and implement programs to combat mass unemployment. Number two, to articulate policies aimed at developing work programs with labor-intensive potentials. Number three, to obtain and maintain a data bank on employment and vacancies in the country with a view to acting as a clearinghouse to link job seekers with vacancies in collaboration with other government agencies. And then number four of his objectives is to implement other policies as may be laid down from time to time by the board established under Section 3 of the Enabling Law. Now, NDE operations started operation or commenced its operation in January of 1987 with visible presence in all the states of the Federation. Now, in order to fulfill their mandate or these objectives we just listed right now, the NDE introduced four major areas of intervention towards mass job creation for unemployed Nigerians as follows. Number one, the vocational skill development, intervention. Number two, entrepreneurship development intervention. Number three, agricultural skill and training intervention. And then number four, public work programs. Now, since the employment is dynamic in its form and pattern, regular innovative strategies are required to tackle it effectively. So to this end, any other innovation can be effectively suited within the framework of any of the four major areas of intervention: vocational skill development, entrepreneurship development, agricultural skill training, and public work program. Now, what are the achievements of this particular NDE program? For nearly 3 decades now, and even till today, through the machineries of skill acquisition and the vocational, agriculture, and entrepreneur and activities in the public work sector, as well as collaboration with other local and international organizations and private individuals, this NDE has impacted a total of 3,625,930 unemployed Nigerians. As at the time of writing this document, of course, it has increased. This number has increased. This does not include the over 9 million persons cancelled over the period. So the next program is the National Health Insurance Scheme. This is relatively a newer one compared to the rest. The National Health Insurance Scheme, the NHIS, life expectancy, especially this program was established because the life expectancy, especially in sub-Saharan Africa, dropped due to inappropriate diet. People were not eating well. People lack exercises, a lack of exercise. People were not exercising properly, and mostly stress were affecting people in this part of Africa. Healthcare quality, quantity, and costs have equally deteriorated in sub-Saharan Africa. You know, Nigeria is part of this area. And the World Health Organization noted this. And other human organizations have been ringing the bell, the alarm bell of imminent danger to citizenry in developing countries like Nigeria. Now, to meet these challenges or this challenge, the government of Nigeria constituted various panels whose recommendations were always eventually culminating in the enactment of a national health insurance scheme. So as at 1999, the law came into existence. So according to the Nigerian government, some of the reasons for establishing the NHIS were: one, the poor state of nation's healthcare delivery system. Two, the second reason why the NHIS were formed was the excessive dependency and pressure on federal government to finance the entire healthcare delivery system in the country. Number three reasons for NHIS was rising costs and underfunding of healthcare delivery. The fourth reason for establishing it was poor integration of health facilities in the healthcare delivery system. Now, NHIS, as the name implies, is a kind of insurance scheme where many individuals or insured pool their resources together. That is, they contribute small, small money here and there together for the protection of anyone in this pool of insured, in this group, who might fall ill within the period of the insurance. You see it. Now, you know how insurance works. This is how insurance works. Insurance works this way. All of us pay small, small money and insure ourselves maybe on health, on life, on something, on something. Now, in the course of insuring for a period, maybe a year, not all of us will fall sick so that the insurance company will pay us. So some will contribute that money and not fall sick, so no wahala. But because the money is small, 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 and because it's contributed together, the money becomes big. Anyone that falls sick, the insurance company can pay for that person through the money all of us has contributed. That way, that person will get his health paid for, and others that are not sick are well. The one that is sick will get well. So that's how insurance works. All right. Now, the drivers of the schemes are called health management organization, HMOs. The providers of the actual medical services are professionals called healthcare providers, professionals like doctors and all that. Okay, so we have HMOs and we have healthcare providers. Now, what is the objective of NHIS? One, the first objective is to ensure that every Nigerian has access to good healthcare and healthcare delivery services. Two, protecting Nigerians from the financial hardships of huge medical bills whenever they visit our hospitals. Three, managing the rising cost of healthcare services in Nigeria. Four, ensuring equitable distribution of healthcare costs among different income groups. And then five, ensuring adequate distribution of health facilities all over Nigeria. The sixth objective is to ensure efficiency in healthcare services, both in the public and private sector. The seventh objective is maintaining high standard of healthcare delivery service within the scheme. Yes, okay, that's the eighth. Then the ninth, ensuring equitable patronage of all levels of healthcare. And number 10, ensuring the availability of funds to the health sector for improved services. Okay, now the workings of NHIS. How does it work? It's important you know this, so just listen. The HMOs, the HMOs are the health management organizations. What do? They are required by the NHIS law to collect contributions from patrons to the scheme and maintain an effective pool of healthcare providers, that is professionals, hospitals, clinics, dental and optical clinics, and so on. Now, contributors to NHIS on regular payments of their contribution are entitled to visit the appointed healthcare providers appointed by their HMOs. Whenever they are ill, they can visit them, or require medical advice and attention, they can visit them. Note that the HMOs are required by law. They are required by law to ensure that the highest quality and quantity of healthcare services are provided by their appointed healthcare providers. To guarantee financial adequacy of the scheme, the NHIS law requires all HMOs to have approved a comprehensive insurance cover to the tune of 100 million. From this insurance cover, the HMO is indemnified against incidents of default in the settlements of claim by healthcare providers or by patrons of the scheme, that is, insured persons like you and I. All right. Now, registration and contribution of employers and employees into the scheme. All employers having 10 persons in their employ or more than 10 employees and above are required to register their company and their employees with a HMO and to pay to the designated HMO the contributions at such time and manner as provided in the guidelines issued by the NHIS Council or as agreed to with the HMO where there is no guideline from the NHIS Council. Now, employers are forbidden employers are forbidden by the NHIS laws from deducting their share of the NHIS contributions from the employee's wages or emoluments. So the employee must contribute his own share. The employer will contribute his own share. The employer is not allowed to take all the money from the employer to pay for the employee. The employer is not allowed to take all the money from the employee to pay. He has to pay his own. The employee has to pay his own. Now, self-employed people or others who are described as voluntary contributors under the NHIS law and who want to enjoy the benefits of the scheme are permitted to register and participate in the scheme by choosing a HMO of their choice. Okay. Now, what's the benefits of under the National Health Insurance Scheme, NHIS? Persons registered under the NHIS schemes, or the various NHIS schemes, are entitled to enjoy insured benefits based on the contracts that they have entered with their appointed HMOs. Common services envisaged and enumerated under the NHIS laws include one, defined elements of curative cares, so they can assess curative care from the professionals. Prescribed drugs and diagnostic tests can be assessed. Maternity care for up to 4 live births for every insured person can be covered under the scheme. Um, Preventive care, including immune stations, family planning, antenatal care, and postnatal care are covered by the scheme. Consulting with defined range of specialists, health hospital care in a private or public hospital in a standard ward, eye examination care, excluding tests and actual provision of spectacles. Then a range of prosthetics and dental care are defined by the council. Now, what are the failures that may have that was the immediate problems with NHIS include there is a limitation on the scope of the service and preferences of medical professionals that contributors to the scheme can assess and enjoy. You know, what we understand about the program is that if you have you are an NHIS and go to some hospitals, they would choose the kind of drugs that we give to you. They will limit you to the kind of specialists. If their specialists are very expensive, they will not want you to go there because they want you to attend to the cheaper one. Then they can bill your HMO more and get more money from them. Now, number two, there is also inadequate publicity on the existence and benefits of the scheme. Well, some companies don't even know it exists. This is especially amongst members of the informal sector of the economy, who constitute a vast majority of the economy. Number three, sort of failure of the program is that there are still a very small number of participants, stroke contributors to the scheme compared to the population and working class in Nigeria. And this is because of the low per capita income in Nigeria. In comparison, the current high rate of contributions by the HMO is a disadvantage of spreading the net and having more participants in. Now, the Public Officer Protection Law requires special notices and procedures before lawsuits can be brought against members of an NHIS scheme and the staff. This application of this law to this scheme is unfortunate, as the Public Officers Protection Act is an archaic colonial legislation. It is suggested that this provision be removed and substituted with a kind of insurance indemnity covering exposure such as this. Okay, we've discussed today the Mass Mobilization for Self-Reliance, Social Justice and Economic Recovery Program, the River Basin Development Authority Program, the Nigerian Agricultural Insurance Corporation Program, the NDE program, yeah, and the National Health Insurance Scheme. So that's about it today. So it's time for us to ask our questions. For those that are here, I really want to ask questions. You can now put up your hands and unmute yourself and ask. Benjamin, your hand is raised. Can you ask your question now? I can hear you.
Yes, sir. Good evening, sir.
Good evening.
Yes, sir. My question is that, sir, I want to understand the word egalitarian society. I want to know, I want to understand that.
Egalitarian. Let us look for what the dictionary says about it. Let's see. Where is the page where I have that? Let me see. That's good. Okay, where is that? Okay. I don't know where it was again, but let's start. Okay. Okay, yeah, it is. It is. So when we say egalitarian, let me check my dictionary what it says. Now, it means an egalitarian person
Hello, Madam Blessing. Good evening. Hello, Blessing. Are you with me?